everyone, I am Dr. Nisha Bhatnagar, Medical Director at Aveya Fertility and IVF Center. Welcome back to our YouTube channel. Today I am going to talk about a very important topic that affects almost everyone taking infertility treatment. Yes, you guessed it right. This is the cost of IVF treatment and the factors affecting the cost of IVF treatment. IVF was supposed to be a very expensive treatment a few years back, but various innovations in the field of IVF infertility treatment or ART services have brought down the cost a little bit. But there are still various parameters which affects this cost a lot. Let's talk about them one by one. So the first most important parameter which affects the cost is treatment plan complexities. We don't know what kind of treatment is needed for you, whether you need 1 cycle, 2 cycle. You need to understand that each human being is different. The plan of treatment would be different for everyone. The medication needed would be different for everyone. There might be certain additional things for one couple, but there might not be anything for another couple. It may be simple for one, it may be complex for another. So treatment plan complexities affects the cost of IVF cycle. The second most parameter is number of IVF cycle needed. See, each human being is different. Even if a doctor has done thousands of cycles, you are the first person there for yourself. Your genetic makeup is different. We even don't know how the embryos are going to be. If you get enough number of embryos after 1 cycle of pickup of eggs, then yes, of course, the cost comes down. But if the number of embryos is less and unfortunately you don't conceive in 1 cycle, you might need more than 1 cycle, and that affects the cost a lot. You might need something else, you might need donor, you might need some other treatment, so that affects the cost a lot. So the next factor is additional services required. For example, if a person with a mild tubal factor only, she needs just the tubes are blocked, she needs 1 IVF cycle, good embryos are formed and she gets pregnant in the first cycle itself. But there might be someone who has a polyp, or there might be someone who has a fibroid. You need to remove the polyp, you need to remove the fibroid, or sometimes you might need to check the receptivity of the uterus. These all are additional treatments. So they cost separate, and that increases the total cost of IVF. So the next important factor is medication required. So it might be just a male factor. Only you get 1 cycle, you get enough number of eggs, enough number of embryos. You don't need too much of medication. On the other hand, your body may require high doses of gonadotrophins or high doses of purified gonadotrophins. That contributes to cost a lot. Cost of IVF is divided in 3 parts: the basic cost, the cost of medication, and the cost of freezing. So the basic cost is always going to be there. That is the cost of scans, ultrasound, pickup, ICSI, embryo formation and transfer. Then the cost of medication. It depends upon what kind of medications are used, how long they lasted, what doses they are given, whether there was purified gonadotrophins or simple HMG was used. This whole thing affects the cost a lot. And then the cost of freezing. If you have enough embryos, that needs to be frozen. But in a way, the freezing cost is sort of an investment for you only. Because if you have more embryos, you in fact have more chances to get pregnant. Another important factor is the clinic expertise and the clinic reputation. There are certain high-end clinics who use very good reputed medications, and they exactly tell you they use high quality media and all. So the cost may be little higher depending upon sort of branding. But on the other hand, there are certain people who might be able to give you quality treatment at low cost also. You need to do your research and find out that what exactly where you are planning and what kind of expertise are there in the clinic. For example, things like laser assisted hatching, ICSI or blastocyst transfer, the cost would obviously be a little higher. Another important factor is geographic location. The clinics located in big cities where the infrastructure is huge and the cost is also high. However, in a small village or a small setup, small city, the cost may not be that high. One important thing I want to tell you is that some companies have started giving insurance for the infertility treatment. So if you belong to some corporates also are providing insurance for infertility treatment now. So if you have some sort of insurance plan, then it helps you to recover the cost. So there are some places where even government is giving insurance for doing some 1 or 2 cycles. So you need to do your basic research, find out what is exactly right for you, and then proceed for IVF treatment. You need to remember that cost, it does not guarantee you success. You can get quality treatment even at a lower cost, and even after spending a huge amount, it might not give you a result. So do your basic research, find out what you exactly need and what would be the tentative cost for you. If you need any other financial consultancy for IVF treatment, or you have any questions regarding this, please feel free to contact us at the given number. We are always there to help. Thank you so much.